Viral and bacterial diseases of the nervous system in swine. The viral diseases are rabies, Ojeski's, and Telfins. And the bacterial diseases are Streptococcus suis, Glasserella parasuis, and E. coli, which causes edema disease. Rabies, which causes zoonosis, is very rare. It's a notifiable disease, and it's caused by the Lassa virus. The signs are fever, anorexia, and depression, especially salivation. And the central nervous system signs are aggressive, head pressing, and ascending paralysis, so hind limb weakness. For the lesions, they can be seen in the spinal cord, and then the brainstem, and sometimes the cortex. Non-suppurative encephalomyelitis can be seen, as well as perivascular cuffs due to white blood cells, such as lymphocytes, plasma cells, and macrophages. Diffuse and multifocal gliosis can be seen, as well as neurophagia, and hemorrhages and vasculitis in the grey matter. For Ojeski's disease, it's a rare but notifiable disease, and the animals are lifelong carriers. It's caused by porcine herpes virus 1. Infection occurs through contact with infected animals, such as wild boars. In non-nursing sows, we can see abortion and reproduction problems. In piglets under 3 weeks old, we can see GI and respiratory problems and neurological problems. Symptoms are anorexia, vomiting, diarrhea, and respiratory signs, and incoordination and seizures. In older animals, we can see respiratory signs and neurological signs, such as fever, anorexia, respiratory signs, seizures, and blindness. And if cats disappear on a farm, suspect Ojeski's disease. In chronically infected herds, we can see reproduction problems, so that there's decreased reproduction parameters, such as mummification and dead piglets. And the differential diagnosis for this is PRSS. Teshin's disease, which also has the Telfin strand, is a rare notifiable disease in Hungary, caused by the Techo virus, which is part of the Picornaviridae. Techin is the virulent strain from Russia, and Telfin is the low virulent strain from Europe. Infection spreads due to contact with contaminated equipment, vehicles, and infected animals. For the pathogenesis, it enters the body orally, and then it goes to the gut lymphoid tissue, and it causes viremia, and then it goes to the nervous system and affects the motor neurons, and it's shed in the feces. For the signs, for Teshin's disease, it's not in Europe, but affects all age groups, and there's the first phase is fever, and then the second phase there's no fever. And the piglets get ataxia and opisthotonos and hyperesthesia and paralysis, and then they can get death through their respiratory muscles not working. And the adults can get flaccid paralysis of the hind limb. And for Telfin's disease, it's milder signs, and that occurs in animals less than 4 months old, mostly around weaning, which is between 5 and 8 weeks old. Get ataxia and transient high limb paralysis. For the diagnosis, you need to send a live piglet to the lab, and the differential diagnosis is classical swine fever, African swine fever, Ojeski's, rabies, and Glasser's, and edema disease. Streptococcus suis, it's a zoonotic disease. For the pathogenesis, it goes from the tonsils, and then there's a hematogenous spread, and it goes to heart, respiratory tract, and nervous system. For the signs in weaned piglets, there's sudden death, fever, depression, and pericarditis. And in the central nervous system, they can get meningitis, as well as reddened, blotched skin, and lameness, and opisthotonos. And they can get paralysis and seizures. In sows, they can have decreased reproduction, and they can give birth to dead piglets. And in around piglets 2 or 4 weeks old, all the way up to fattening, they can get respiratory signs and pneumonia. It's usually not treated, but in individual cases you can give penicillin, and if there's nervous system signs, you euthanize the animal. For Glasserella parasuis, for the pathogenesis, it occurs in the upper respiratory tract, and then if there's lower maternal immunity, there can be hematogenous spread to the serosa. It occurs in piglets around 4 to 8 weeks old, and there's sudden death. They get high fever, coughing, and arthritis, as well as tremors and seizures. If it's chronic, they can get fibrin on their serous membranes, and it can cause adhesions. And this causes an economic loss at slaughter. In the lesions, you can see septicemia, pleuritis, pericarditis, and meningitis. It's usually not treated, but you can give enrofloxacin, ceftiofur, and penicillin and tymulin. For edema disease, also known as bowel edema, it's rare, but it's caused by E. coli verotoxin. For the pathogenesis, bacteria attaches to the intestinal wall, and then verotoxin is normally prevented by maternal antibodies. But when there's decreased maternal immunity, the toxin becomes absorbed. And this causes edema in the stomach and intestinal wall and the brain. And for the clinical signs, it occurs in animals around 4 to 8 weeks old when they have decreased maternal immunity, and they can get sudden death, as well as staggering, incoordination, lameness, and partial paralysis, as well as opitotinus and seizures. They also get swollen eyelids. For the treatment, it's usually not successful, and for prevention, you can have vaccination, clean environment, and early weaning, and restrict feed.